This virus, called 2019 nCoV, is new and we are still learning about it. From what we know now, it can make some people a little sick with a slight runny nose. Other people get more sick and can have difficulty breathing and develop pneumonia. Some people get very sick and need to be hospitalized. Among those, unfortunately, some have died. While we still need to learn more about how the disease affects people, thus far, most of those that died had other underlying health issues. This information will change as we learn more about this disease. WHO will continue to provide updates as more information becomes available. If you need more information on the new coronavirus, check the WHO website at who.int. The new coronavirus can spread through respiratory droplets, which are liquids that may come out when we cough or sneeze. For this reason, it's very important to avoid close contact with anyone who has fever and cough or other respiratory symptoms. In practical terms, we recommend keeping at least 1 meter distance from a sick person. Also, you should avoid shaking hands, hugging, or kissing people with these symptoms. If you need to take care of a person who has fever, cough, and difficult breathing, do not forget to wear a mask and, in particular, to practice hand hygiene. If you need more information on how to protect yourself from the new coronavirus, check the WHO website at who.int. There are several measures you can adopt to protect yourself and others from getting the new coronavirus. Frequently clean your hands by using an alcohol-based hand rub product like a gel, or wash your hands with soap and water. When coughing and sneezing, cover your mouth and nose with flexed elbow like this, or use a tissue. If you use a tissue, discard it immediately into a closed bin. Avoid close contact with anyone that has fever and cough. And if you have fever, cough, and difficulty breathing, seek medical care early and share information about any recent travels with your healthcare provider. If you just have mild respiratory symptoms and no specific travel history, carefully follow the precautions I just explained and make sure you stay home until recovery. If you need more information on how to protect yourself from the new coronavirus, check the WHO website at who.int.
Medical masks like this one cannot protect against the new coronavirus when used alone. When you wear them, you must combine with hand hygiene and other preventive measures. WHO only recommends the use of masks in specific cases. If you have cough, fever, and difficulty breathing, you should wear a mask and seek medical care. If you do not have these symptoms, you do not have to wear masks, because there is no evidence that they protect people who are not sick. However, if you are healthy, but you are taking care of a person who may be infected with the new coronavirus, then you should wear a mask whenever you are in the same room with that person. And remember, if you choose to wear a mask, use it and discard it properly, and clean your hands with alcohol hand rub or soap and water. For more information on mask use, other preventive measures, and the new coronavirus, check WHO website at who.int. Thank you. If you decide to wear a medical mask which is pleated and flat like this one, it is important to wear and discard it correctly. Otherwise, instead of protecting you, the mask becomes a source of infection because of the germs that may stay on it. To wear it correctly, you should locate the metal strip at the top of the mask, place over your nose bridge, secure the elastics around your ears or tie the strings behind your head. Make sure it covers your nose, mouth, and chin. While in use, do not touch the front of your mask. To remove the mask, take the elastics from around your ears or untie the strings behind your head. Do not touch the front of the mask as it may be contaminated. Remove the mask and discard in a closed bin. Cleanse your hands with alcohol hand rub or soap and water. Hand hygiene should be done if you accidentally touch the front of your mask while wearing it. If your mask becomes damp or humid, replace it with a new dry mask. Never reuse single-use masks and discard them immediately into closed bins after each use. For more information on mask use and the new coronavirus, check WHO website at who.int.